Good day, I'm Chanel Margaret Valde from BSN 2A, and today I'll perform administering oral medication. Medication, it is a substance that is administered for diagnosis, cure, treatment, relief of symptoms, or prevention of diseases. And oral route is the most convenient and less expensive route for medication administration, in which drugs are swallowed with fluid or given via gastrointestinal tract. And the common drugs in this route are tablets, capsules, liquids, solutions, suspensions, syrups, and elixirs. In doing so, it is important to remember and adhere to the 10 rights of medication administration to avoid making errors and to ensure client safety and well-being. In administering oral medication, we will be needing the prescribed medication, medicine tray, medicine cup, medication card, medicine dropper for pediatric patients, towel, and the use of sterile gloves is optional. So first, we will begin with the assessment. Verify the physician's order of medication, and then check the medication list on the medication card against the physician's order sheet or standing order sheet. This is to know what medication is to be given to the assigned patient. Also, the physician's order sheet, it contains the drug's name, the frequency, the time, the route of administration, as well as the medication order contains the client's full name, the date and time the order is written, the dosage, time, frequency, the route of administration with the signature of the physician. And this is important to ensure that we will be able to prepare right medication for the right patient according to the doctor's order. And then check the client's chart for allergies to avoid giving medications that could possibly trigger the client's allergic reaction. Know the action of the medication, special nursing considerations, safe dose ranges for us to be able to give right medication with right dosage appropriate to the patient's age and condition. Also, know the purpose of the medication because it is important for us to explain to the client why we are giving a certain medication to them, as it will also encourage them to cooperate and to take the medication willingly. And lastly, know the adverse effects of the medication to be administered to avoid giving medications that could possibly harm the client's condition. And then for the planning, wash your hands to minimize the spread of infection and to prevent cross-contamination of microorganisms. And then prepare medication for one client at a time to avoid making errors in medication administration, such as switching medications for different clients. And also ensure adequate lighting to facilitate ease in administration, since we also need to read some medication label for some instruction. So now for the implementation, first, select proper medication on the drawer or stock and compare with the Cardex. This is to confirm the name of the medication by comparing the label with the Medication Administration Record or MAR. And then check for expiration date and perform calculation. It is to ensure that we can still give the medication to the client if it is not yet expired, because if it is already expired, then it could be non-functional and it could cause harm to the patient. And if the dosage of the medication did not match the prescribed dosage, we need to check and perform calculations to give the right amount of medication to the client. So according to the doctor's order, we will be giving our client an ascorbic acid vitamin C with a dosage of 500 milligrams. And the medication or each tablet has 500 milligrams, so we're going to give our client one tablet of vitamin C, the ascorbic acid. For unit dose package medication, place the tablet or the capsule directly to the disposable cap or to the medicine tray, and do not open the medication until at the bedside of the client or until the time that the client will take the medication. Because the wrapper keeps the medication clean, and it will also help us to identify the medication if the client refuses to take or was withheld to take the medication. Also, an unopened medication can be returned to the cart. And then next, for medication that is in a stock container, pour the necessary amount or number on the bottle cap, and then place the tablet in the medication cup. And this minimizes the transfer of microorganisms. And then next, for medication or liquid medication, remove the cup. Remove the cup and place it upside down. This to prevent contaminating the inside of the cover. And then hold the bottle with the label against the palm of the hands to prevent the label of the medication from being soiled or illegible, since we need to read and to understand the label medication for some instruction. And then after that, place the medication cup in a flat surface at the eye level, and then pour the desired amount of liquid. And then read the amount of medication in the meniscus or at the bottom of the meniscus. And this is done to allow an accurate measurement of the liquid medication to be given to the client. The meniscus, it is the curve of the surface of the molecular substance as it touches another material. And then wipe the lid or the neck of the bottle with a clean towel, and then recap the bottle. After that, recheck the medication that has been prepared for one client. Again, compare the MAR with the names of medication labels with the patient's name. And then recheck once again before to take the medication to the client to ensure that the medication that has been prepared is correct for the assigned patient, to avoid errors such as giving medications to clients who's not supposed to receive that certain medication. Because all medications has an effect, so it's either it will improve the client's condition or it will cause harm to the client. So we need to avoid making errors in medication administration. And then now, transport the medication to the client and keep the medication in sight at all times. Prevent the capsules, the tablets, or the syrup forms of medication from falling on the floor to prevent it from being contaminated, and so that it could and prevent causing harm to the client. And then see that the client will receive right medication at correct time to ensure that the medication would be effective for the client, because there are also some instances in which when the client is not able to receive right medication at correct time, it could possibly cause them pain or will result to unpleasant client's health condition. So, assuming that we have transported the medication to our client, we need first to identify the client carefully to be sure that we will give the medication to the right client. Good morning, ma'am. I'm Chanel Valde, and I'll be your attending nurse for today. May I know your name, please?
I'm Pensilet Valde.
Alright, ma'am. So, at this time, I'll be giving your medication that was prescribed by your attending physician. So, are you aware of allergies that you may have from certain medication or drugs? Do you have some allergies? Alright, that's good. So, ma'am, your physician has prescribed you with vitamin C, ascorbic acid, with a dosage of 500 milligram to be taken once a day. And it is in tablet form, so you need to take it orally. Vitamin C, it will help to boost your immune system. It prevents you from acquiring chronic diseases, and it is a powerful antioxidant that can strengthen your body's natural defenses. Assess the client in upright or lateral position so the client would be able to take the medication in a comfortable manner. So, ma'am, are you comfortable in your position right now to take your medication? Alright. So, offer the client a water with fluids or any permitted fluid with pills, tablets, capsules, or with some liquid medication. So, ma'am, what do you prefer? Do you want to take your medication in your hand or in cup?
In cup.
Alright. So, here's the vitamin C, ascorbic acid, and here's also a water. Alright. If the capsule or tablet falls on the floor, it must be discarded and new one administered because it is already contaminated, as it has already acquired some microorganisms. Record fluid intake and output measurement as ordered, and remain with the client until all medications has swallowed. It is ensure that the client has taken all the medication that you have prepared that is right for his or her condition. And also, if your client has difficulty on swallowing, you can crush the pills or the tablet using a pill crushing medication, but we still need to administer the crush medication separately. And if your client is confused or known to hoard pills, you can ask the client to open his or her mouth and check under the tongue. So, ma'am, now that we're done, you're done in taking your medication, I'm going to leave now and let you rest. So, do you need anything? Alright. So, I'll be back in a few minutes or an hour to check your condition again. Thank you very much for your cooperation. For the evaluation phase, evaluate if the 10 rights are followed, which are the right patient, right medication, right dosage, right administration, right time, right route, right patient's education, right to refuse, right documentation, and right evaluation. And also, evaluate if the correct site is used, as well as the effectiveness of the medication that has been administered, and the side effects of the medication that we have given to the client. So, after an hour of giving the medication to the client, there is no side effects that was seen. There was no abnormal effects that was observed. And for the documentation, record the pertinent data such as the medication, dosage, the route of the administration, time of administration, and the signature. So, I have given my client 2 types of drugs. I want one type of drug. So, it is an antioxidant, an ascorbic acid, vitamin C, with a dosage of 500 milligram to be taken once a day, and it is taken orally. Also note for the complaints of patients, if medication has been omitted, we also need to record the reason for omission. And do not forget to affix your signature to the documentation sheet because it signifies that you have carried out the physician's order. And remember that everything that is not properly documented is considered as not done. And that's the end of the demonstration. Thank you and God bless.